The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of the patient's story. This is the time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough physical exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me, I listen to what they're saying, and I feel them both physically and emotionally. This way, when you come into my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. To maintain a clean and safe environment, my office has several ultraviolet C-wave lights to sanitize and kill bacteria and viruses. If you wait, it's too late. To my military family, I got your six. To my Masonic brothers, the light is bright. Today's topic, sexually transmitted diseases. This is a hot topic, something that we all understand, something that a percentage of the population has experienced. Summer's fast approaching. We have a few more weeks, and when summertime, what do? We socialize, and we socialize around food and drink, specifically adult beverages. Well, when we take a lot of adult beverages, specifically alcohol, alcohol is known as a disinhibitor. A disinhibitor is a substance that prevents the higher understandings in a center that controls our decision making, and it prevents us from making proper decisions, or limits our decisions, meaning that making the proper decision and saying no. It's prevents us, that area of the brain prevents us from taking high risks. Well, when you drink alcohol, we end up taking high risks, meaning in this case, socializing, drinking alcohol, and taking high risk behavior, meaning sex and unprotected sex. Okay, so that's why we're discussing sexually transmitted diseases. Sexually transmitted diseases are generally acquired by sexual contact. The bacteria, viruses, or parasites, that's right, you heard me right. Bacteria, viruses, and parasites, that's what cause sexually transmitted diseases. And it may be passed from person to person via blood, semen, or vaginal or other bodily fluids. Sometimes these infections can be transmitted non-sexually, such as from mother to infant during pregnancy or childbirth, or through blood transfusions or the sharing of needles. Now, I'd like to go through that statement right there because I've seen this through my training. I remember when I was a senior resident and I was on call in the labor and delivery, and a female, she was pregnant and getting ready to deliver. She has a history of a sexually transmitted disease, specifically a herpes simplex. Well, during the vaginal inspection right before delivery, we did not see any lesions. Well, it turns out that she must have had lesions internally, because when she delivered, the infant was diagnosed with neonatal herpetic lesions, and we had to place the infant on antivirals through IV. And within 24 hours, like 90% of the lesions were already healing, which was something that we all, the pediatrician and myself and my colleagues, we couldn't understand. We just was like, wow, we could not believe how fast the medicine worked. Again, the infant, they're growing exponentially, and so the healing process a lot faster than as we age. Now, the second was through infant during childbirth here. Now, through blood transfusions. Today, we screen out the blood. We make sure the blood is clean before we give the blood to a donor. It gives the blood to a recipient. But prior to us understanding HIV, a lot of individuals who contracted HIV that were not in the alternative lifestyle, and that's the term I grew up with in the 80s, alternative lifestyle, meaning gay, lesbian. Specifically, this was within the male-to-male contact. Meaning gay, we use the term alternative lifestyle. Prior to that, they weren't screening out for disease, maybe hepatitis. So there were a lot of individuals that were going in for surgery and required blood transfusion that acquired HIV. Sharing of needles. Well, we know IV drug users, they share needles. It's not sterile. They just, they'll shoot up, and then they'll heat up whatever they're shooting, and they'll pass it on to the next individual. Well, you're passing on because there's some blood on the tip of the needle. And they transfer diseases, hepatitis, HIV from one individual to next. Especially like in the Bronx, we would have crack houses where you had individuals in the house, and they would just, either selling their body for $5, $10, $15, $20. People don't realize that crack, it has like a 5-minute high. That's it. And so what they do is they run out of money and they start selling their body. And so that's a high-risk behavior. And they start to contract all sorts of diseases, sexually transmitted disease and HIV, and then sharing of needles, because it's not like they have a supply, so they just pass the needle down, and that's where they transfer sexually transmitted diseases, specifically HIV and hepatitis. Did you know that sexually transmitted diseases can have a wide range of signs and symptoms, including no symptoms at all? Signs and symptoms may appear a few days after exposure. Now, in the ER, when we're doing ER rotations, we can pretty much graph out what today's conditions will be. Now, typically, a incubation period for sexually transmitted disease is 3 to 4, maybe up to 5 days. There's a few that could take up to 7 days. So let's take an average of 3 to 4 days. So if you're sexually active, unprotected, high-risk behavior, multiple partners on Friday night. So you got Friday, then we have Saturday, Sunday, Monday. Monday and Tuesday are typically higher in with sexually transmitted disease screenings. Someone will come in with a complaint of, maybe some sort of discharge or an itch or some sort of lesion on their genital area. And that's when we see the highest in ER. I mean, any particular day you could see this, but typically it's higher on Mondays and Tuesdays. Then you have certain diseases that you might not see. I'll give you an example, like syphilis, you might not see. There might be an initial lesion, and you might even not know that, like a red rash, and you don't realize it. And then we do history and physical. We draw blood work, and your RPR or VDRL, and that's what we use to screen for syphilis, comes back positive. Or let's say for individuals who don't go to their doctor, that's why I'm here. I like to see you so I can screen out for these. They don't go to the doctor, and next, it's 5, 6, 7 years or 10 years later, and they start seeing neurological changes, and then it turns out that they have tertiary syphilis where they have neurological issues. All right. So that's why I keep saying it's so important that you need to have a history and physical and routine blood work so we can screen out for sexually transmitted diseases. Or if you have any signs and symptoms of sexually transmitted disease, come on in. We can test you. All right. So let's go over, we have about a minute. And the next section is going to be signs and symptoms that might indicate a sexually transmitted disease. Why don't we hold this for the second half of the show, and when we come back, we'll cover those, and then we'll go over risk factors. So let me help you lead a happier and healthier life. If you wait, it's too late. I offer a very affordable concierge practice at the price of less than the cost of a monthly cell bill, which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. To learn more about my practice, go to drtommyoak.com. That's drtommyoak.com. Or give me a call at 631-980-8200. That's 631-980-8200. Remember, if you wait, it's too late. Make that call. Set an appointment. Same day or next day office visits. I'll take care of you. I'll treat you like family. Come in. Back to the Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. Today's topic, sexually transmitted diseases. So let's continue. First half, I ended off with getting ready to discuss signs and symptoms that might indicate sexually transmitted disease. Remember, the key here is reducing the risks, reducing high-risk behavior. Well, again, this is something in history. It doesn't matter what part of life you're in. It's risks versus benefits. If the risks are high, the benefits are low, that's a no. When you drink alcohol, which is a disinhibitor, and then you make poor decisions. Now, it's a high risk, low benefit. You're going to end up saying yes, and then you're going to end up developing or possibly developing a sexually transmitted disease if you're sexually active and unprotected, or sexually active unprotected with multiple partners. So what we want to do is reduce the risky behavior. All right, on to signs and symptoms that might indicate sexually transmitted disease. Sores or bumps on the genital or in the oral or rectal area. Painful or burning urination or change with urination. Discharge from the penis or the vaginal vault. Unusual or odorous vaginal discharge, right? There's no odor, okay? You shouldn't have any odor. Same thing with male. We are, our genital area is dry. If it becomes moist, you feel what we call the drip, and you feel like a dripping sensation that's coming down the urethra. There's something going on. It needs to be examined. We need to treat that. Examine it and then treat it. Unusual vaginal bleeding. Pain during sex, okay, when you start to get into pelvic inflammatory disease, and that is what we consider a chlamydia and gonorrhea, a dual infection, one or the other, or both at the same time, and the infection spreads within the body, okay, not within the vaginal vault. It is now up and inside the body, and it's causing problems, and that could lead to infertility. That must be diagnosed and treated immediately. Sore or swollen lymph nodes, particularly in the groin area. The groin. What's the groin? Well, that's what the genital area is. Just think of you have your underwear, and then you have the band that wraps around your thigh. Well, that's the inguinal canal, and that's where we have glands. Or when someone who's ever had an inguinal hernia, and that's what we're talking about. We have lymph nodes there. Well, what is a lymph node? A lymph node's a gland, and it's a collection center. And when it collects a byproduct, breakdown byproduct. And when you have an infection, it starts to swell up because it's collecting the byproduct of the infection. So they start to swell up and they become very, very painful. And that's telling you something's wrong. Either you have a cut or you have some sort of infection down there and it needs to be addressed. Lower abdominal pain, again, with the pelvic inflammatory disease. Fevers, okay, it's an infection. So the body's trying to fight it and your body temperature goes up and you develop a fever. Rash over the trunk, hands, and or feet. Typically, you'll see this with syphilis, but there's other conditions you can see this with. All right, so let's go on. What causes STDs? All right, sexually transmitted disease. We'll start with bacteria. Bacteria, that's chlamydia, gonorrhea, and syphilis. All right, so chlamydia, typically you're going to have a vaginal or a penis discharge that has a yellowish discharge, okay? Then you have gonorrhea. Same thing, you're going to have a discharge, both areas. This time it will be green. With syphilis, there's no discharge. It'll start off with a rash. Now, if you don't see the rash in time, because a lot of times you just don't see it. Let's say it's summertime, and you contract syphilis, and it might not notice the rash. Then when we do a blood test, which is annual, it's a screening test that comes back positive, and we start to treat you. This particular disease, one of the treatments would be a penicillin 3 shots, and it's a very thick, viscous, almost like injecting like a milkshake into the cheek there, and it is painful. And that's going to remind you not to do it again, all right? Parasites, okay? Yes, parasites. Parasites can cause sexually transmitted diseases, specifically trichomonas, all right? What do we see this? I studied this in medical school, and I did not see this during my training. However, I was 3-4 years out of residency, and then we saw a new wave of immigrants that was coming from the Caribbean. And in the Caribbean, we have what's called sexually transmitted or STD belt, and that's the sun belt where it's warm. We also see it in the Caribbean, the warmer states, and in the Caribbean, we see a higher prevalence of sexually transmitted diseases. In this particular case, we had immigrants that were coming in from the Caribbean, and we saw a spike in this particular disease. And how do we discover this? Well, you're going to have a foul odor, you're going to see a discharge, but typically on a pap smear, when we look at the cervix, right where the cervical is, it's gonna look like a strawberry, and then we say, oh boy, you see tissue changes. I take a sample, I send it out to PAP, the rule out cancer. Sure enough, it comes back positive, and I have to treat it. Okay. The next is viruses, right? Viruses. That's right, viruses. Herpes simplex virus, hepatitis, HIV, and human papilloma virus, and that's where your pap smear comes from, all right? So herpes simplex, you got herpes simplex 1, herpes simplex 2, and then we have what's called, it's not sexually transmitted, but we have the herpetic family of viruses, and that'd be herpes simplex 1, herpes simplex 2, we got herpes varicella, chickenpox, then we got herpes zoster, which is the shingles. What do they have in common? Blisters, okay? The virus penetrates our body either through touch or inhalation, and then the body wants to get rid of the virus, and it pushes it out of the body in a blister form. Well, within the blister, the fluid, that's where the active virus is. So if you have herpes simplex 1 or 2, because typically for board questions, we said 1 above the belt and 2 below the belt, but because of sexual practices, you can see herpes simplex 1 in the genital area and herpes simplex 2 on the lips, what we'd consider canker sore, or a dentist will call it a stress ulcer. But we treat them exactly the same way, okay? So we use an antiviral, and this will help reduce the signs and symptoms. Unfortunately, once you have herpes simplex, you have that for life. We always say it's the gift that keeps on giving. So you have a blister, and the blister ruptures during friction. You have what we call micro tears within the tissue, and the virus penetrates the abraded tissue, because that's what it's called. The micro tears is called abraded tissue. The virus penetrates, and then you contract the disease. And then, the first year, typically you see a lot of, most amount of outbreaks, and from that point on, the body's able to suppress it. Sometimes you need to go on suppressive therapy, antiviral therapy, but typically for a healthy individual, the body's able to start reducing the number of outbreaks, with each passing year. But you have that for life. We'll go into risk factors. All right. So anyone who is sexually active risks some degree of exposure to a sexually transmitted disease. Factors may increase the risk are having unprotected sex. Oral sex may be less risky, but infections still can be transmitted. All right, because let's say if they have herpes simplex and you're performing oral, you can easily absorb the virus in the abraded tissue. Having sexual contact with multiple partners. We know that statistically, the more partners you have, there's an increased risk for developing sexually transmitted disease. If you're going to have multiple partners and that's your lifestyle, at minimum, the person must wear a condom. We want a latex condom. Having histories of sexually transmitted disease, this increases the risk for developing other sexually transmitted diseases. Misuse of alcohol or use of recreational drugs, again, disinhibitors, and your judgment, it's not there. You're going to make the wrong decision. All right, so let's be smart. Let's reduce the high-risk behavior. I always say, no glove, no love. That was a phrase in the 80s and 90s. It still works today. No gloves, no glove, no love. All right, let me help you lead a happier and healthier life. If you wait, it's too late. To learn more about my practice, go to drtommyo.com. That's drtommyo.com, or give me a call at 631-980-8200.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.